Well, welcome to all C3RF members and friends throughout the nation, indeed around the world, and a special welcome to the folks at Veterans for Freedom as we stream to them on one of their dedicated social media channels. Our C3RF in hot session today should be of great interest to all as it peels back the onion on the how and why of unprecedented attacks on the civil liberties of Canadians over the past 3 years. As we roll in on target, we are fortunate to have with us Natasha Gonek. She's with us today as our wingman. Natasha has been central in the acquisition of Edmonton Police Service information and data through the Freedom of Information process. And this information details the mechanics of the nudging of members of that force to acquiesce to experimental vaccine jabs, even as they use their legal authority to impose freedom-crushing mandates on everyday citizens of that fair town. Natasha is a professional investigator who has worked with regulatory healthcare colleges and the Office of the Chief Medical Examiner. She currently acts as an advisor, advocate, consultant to patients, healthcare professionals, lawyers, employers, and more. So without further ado, I'll bring on board Natasha. Hi, Natasha. It's so good to have you with us today. And now, I note that I take it that you're no longer with the Office of the Chief Medical Examiner or with the any college of any particular stripe. What is your status right now, as it stands?
Yeah, thanks for having me on, Russ, first of all. So my status is that I am not currently employed to any government agency or affiliated regulatory college. That was terminated in early 2022. And I've just been kind of on my own at this point, providing services to fill a gap. There's a huge gap and people were left blowing to the winds, especially when their unions didn't back them and support
Yes.
them.
Mm-hmm.
Yeah, and so I had a lot of people who were in that unionized environments kind of coming to me and saying they won't even process a grievance. They won't represent me. What do I do? And I don't know the process. And lack of understanding is what they've relied on pretty heavily,
Wow.
is that people are not educated on the laws or their rights or anything. So
So,
yeah,
so
so
people,
that's it's been good. Yeah.
so people were stranded, but it sounds like you were stranded back in 2022. What happened in 2022 that put you in this land of being on your own? What happened there?
Yeah, so I was with the College of Regulated, or sorry, College of Nurses at the time in Alberta, and so I was an investigator for them. And kind of in early fall, they had announced that they were going to roll out a mandatory vaccine, even though 100% work from home, no reasonable grounds for it, and the usual. So unfortunately, they had set precedent with me because I had been in a WCB, I had been in a car accident that was covered, and they were extremely respectful of my medical privacy during that time, just prior to COVID, which shocked me that they all of a sudden did an about turn and felt everybody should provide their medical information. And so at that time when they brought in the policy, I didn't believe it was lawful. And we actually investigated this type of thing in the past. So I
Yes.
just refused to provide my personal medical information, no matter what that status would have been. I refused to provide it and was put on the unpaid leave and eventually dismissed
Wow.
from my employment. Yeah.
Okay, you say that you used to investigate these types of happenings, these breaches of privacy on behalf of, I guess the union of the college itself, or any nurses union that would come to you as an investigator and say, "Hey, I got a problem," and you would actually investigate these things. And how would those cases normally turn out?
Yeah, so I investigated from the college side, both for nurses and paramedics in my past. And And how those would go is, I mean, we would take those investigations and look at, the merit of the information. We would apply procedural fairness to it. We would evaluate, are there breaches of the code of ethics, standards of practice? Nurses and doctors and other healthcare professionals are obligated to do the best and provide informed consent and ensure that they are providing proper care at that point of care contact. They're not supposed to have that third party influence that on their medical practice, because ultimately they are responsible for what happens with their patient. And so we would address those privacy concerns are actually huge. And prior to COVID, lack of informed consent and violation of patient privacy was a significant breach of their professional conduct. And every healthcare professional knew that. So it was shocking to see it blown to the wind, and the regulatory oversight actually giving direction that was not in the public interest, which is their primary mandate, to protect the public.
Let me get this straight. It seems to me that in the time period before COVID, there was at least a little bit of motivation to commence some sort of investigation to understand the lay of the land, to understand what was actually happening, and whether complaints were fairly based or not. But you're saying once we got into COVID territory, there was no even attempt at understanding the whole situation as it was evolving on the medical front.
Yeah, it wasn't even just that there was lack of attempt. It was that there was direction being given by these regulatory oversight that was contrary to what they would have normally enforced. So they were actually doing the opposite of what they were supposed to be doing, where they're directing members to snitch on each other. They're directing members that they can't provide their patient with certain medications. I mean, that's not their realm. That's out of their wheelhouse, and yet they were doing it, and they were directing care that ended up causing harm by telling practitioners that they couldn't write exemptions for things that they knew their patients had exemptions for, and so that caused tremendous amount of harm in our population, and it muzzled healthcare professionals, because anybody who spoke out, they went after with professional discipline.
Well, this speaks to actually an active campaign of oppression, basically, to make people succumb to the will of, whether it be the health service or the college or whatever. I noticed I was taking a look at the National Citizens Inquiry, and you were up on that inquiry as an expert witness, and I saw this active campaign in your testimony when you started to highlight the fact that there was money involved with this whole process of making things happen a certain way. Could you tell us about the money that was being pumped into the system to make things go one way by another?
Yeah, there were I call them incentive programs, but there were signups for doctors, for pharmacists, where they actually had to apply and be approved to do the vaccines and the rollout of them. And so they were actually given billing codes that applied to, and something really basic, like the physicians in Alberta were given a billing code to cold call patients who were not vaccinated and educate them on the vaccine. And I'm like, but the substantial breach, people would go, oh, whatever, my pharmacist phoned me. They can't do that. That means they've had to, without your consent, access your vaccination records online to determine you were not vaccinated. So there's a privacy violation, a misuse of net care for their financial gain, because they then got paid $25 just for that phone call or whatever in every province. So and then the influence. Can you imagine? Like I imagine a senior getting a phone call from their doctor saying, hey, I noticed you haven't had your shot yet.
Wow.
can we book you in for that? Or what are your hesitations? The intimidation factor for a patient, that is a boundary that should never be crossed.
Well, I wonder if I got a phone call like that, I'd be wondering what else they've noticed about my medical background or my situation. That it just brings something to mind here that lately, since the advent of COVID, we've had all this big push by federal medical authorities, even by the Prime Minister, to really get into and expand this digitized health record system. As a matter of fact, I believe when provinces sign on to increase transfers of money from the federal government to the provincial government, one of the sticking points is that the province has to go along with this digitized health initiative that is being rolled out. And this, what you're talking about here with your National Citizens Inquiry testimony, is that all this information, once it becomes digitized, it looks like, given the situation, it could be used for whatever purpose the government would like to use it for. It sounds like. Am I off base there with this digital health record initiative?
No, I think it's a really dangerous step to take, and not that the initial intention of it, I don't know what that was, but the fact that medical professionals and government and other agencies that you haven't consented to viewing your medical records would then be able to access them without your knowledge. And that's what happened here. And it was demonstrated in the Edmonton police documents that there was, so they obtained the nurses at occupational health nurses that were providing zero point of care contact and patient care for the officers, zero. They were accessing medical records and had gained the ability during COVID to access NetCare, which is our digital medical records here, of any of the employees for the organization. Now,
Wow.
whether that was misused or not needs to be addressed. However, it does state that they audited the vaccine records of 1,996 employees. Now, I've seen the consent that they allegedly had in this email chain, and that's not consent. Those people had no idea. And I've talked to ones that supported the vaccine and or did that. They had no idea that their medical records were them being audited to make sure they were truthful with the employer. That is not direct patient contact. So that's the difference with a medical record. You can't just access it for human resource purposes. Okay. And that's, the government would be accessing it for program services or something along that line. It's the same kind of violation. People didn't know, people couldn't stop that process. And that's what I see with those. The challenge with the digital record is that who then gets that access? Who's going in there to look at your information? What's the purpose of doing that? Very dangerous.
I guess you would never know who's taking a look at your file and who's doing what to the file. I guess anything could happen, but it's from your experience with your testimony at the National Citizens Inquiry, it looks like it's quite plausible that nefarious things could be done, because if it can happen, it's going to happen. Let's face it. But now you've mentioned the Edmonton Police Service, and what I'd like to do is I'd like to share screen just for a second here. Because I want to draw attention. Can you see that, Natasha? This is your executive summary, analysis of Freedom of Information disclosure documents related to the Edmonton Police Service COVID-19 pandemic response. And I draw the audience's attention to where it is. This one it's residing on a Proton Drive that I picked up from Police on Guard for the website. Your story is up there along with this web edition where people can go and take a look at it. And I just it is extensive. I mean, hundreds of pages here. But I just want to look at the table of contents here just to give folks a feeling for what's inside, and you can see that it's quite comprehensive. Lots of findings and recommendations, and you get into the occupational health and safety aspects of what occurred with the Edmonton Police Service employees. You even get into masking, the vaccination, the testing. So I'll just leave that there, so folks can, if they want to really do a deep dive, they can with your documentation there. Now, that documentation, your report, is based on freedom of information processes. Were you surprised to get this information from the police service in Edmonton?
Yeah, we weren't sure if we were going to actually get the disclosure or not when we put it in, because other areas and other policing agencies have had disclosure requests in for over 2 years now, and they're still not being released, even though the privacy commissioner has ordered them. So
Yeah.
imagine your police service being in contempt of an order just because they didn't want the documents to get out. So we weren't sure what we were going to get and how comprehensive it would be. There's still, of the 8,717 pages that we received, there's still 4,500 pages that we're fighting to get the rest of, or at least we're having them reviewed. So there's large gaps in the information that was withheld. And for the information that was released, it was pretty substantial, and it was pretty damning information. What you showed there is my executive summary that's more for public consumption. The main report's over 400 pages, and it is evidence extracted directly verbatim out of the original documents. And I did the public consumption one just because number one, it's easier for people to read, and it screens out names too. So
yeah. No, that's an excellent idea. Now I noticed that, okay, when we talk about COVID-19, its advent, it's occurring on Canadian soil, we can always say, and the people have been saying for quite a while now, that these extraordinary measures that we employed, whether they be nudging people to get the vaccine or blocking them down or making them wear masks at the Canadian Tire, they're all justified because the threat, the danger was so great. Now, with your freedom of information access, did you find that there was just cause to initiate these emergency measures and basically take away people's privacy rights, their medical rights, their charter rights? Did you find support for that kind of approach?
No, and from the Edmonton Police Service side, there was no information provided that supported the decisions that were being made or the due diligence of the employer to pursue that. They were utilizing the provincial government information. They were utilizing the daily updates by, the chief medical officer of health coming on. They were using information there, but not then assessing specific to their workplace, which is their obligation to do under the law. They have to assess it specifically for the risk in their workplace and not apply a blanket approach to what's going on. And in fact, the FOIP disclosure, when you get those, they also do a closure letter. And one thing in there is that, they also identify that there wasn't documentation existing, including for the medical privacy and stuff. And I'll just give you a quick read and I've read this a lot on things, but it's so important for people to understand, is that because this is the Edmonton Police Service saying that both their pandemic committee and human resources legal department have confirmed that there's no correspondence regarding the forced disclosure of confidential medical information or outlining the grounds allowing the employer to supersede medical privacy, health information, PIPA, FOIP, and labor laws to request medical information. That in itself is a statement that says, no, we don't have reasonable grounds. And in order in a unionized environment to show that, you would have to perform a KVP test, which is a test of the policy that showed reasonable grounds to then change that policy and change the work contract with those employees. There was none of that information presented. There was
Okay.
nothing supporting. Yeah.
Well, perhaps, let's be charitable. Let's say that when with the initial onset of COVID, maybe you think a lot of things were unknown. Maybe for a little while, you could impose these restrictions because on the basis of the precautionary principle. But we're like 3 years into this thing. We're like a long way down the road, and what we're seeing from your excellent research here is that there was no justification for doing this in the first place. Okay, so maybe you were cautious and you shut things down for a little bit, but 3 years later, we're still talking about mandating these vaccines and giving them to kids and all this stuff. I mean, question: the unions. Where are the unions in all this? I mean, the unions, their prime job is to represent their fee-paying members. Where were they when this is all coming down the pike? And it's been 3 years now. Why aren't they saying anything now?
Yeah, well, the union backed the employer in relation to the mandates. And so when the unions, and that's not just the Edmonton Police Association, that's across the board. Everybody I've talked to, I've been reviewing all sorts of documents from agencies now across Canada. Unions backed the employer. They utilized existing case law that applied to vaccines that have been used for decades. So, you did have risk profile and long-term data, and whether you question the validity of that information, it still exists. They weren't noted as experimental or in clinical trial phase, as was openly discussed in the police documents. The union was, in this case, being CC'd on all correspondence for the information for senior leadership. So they were getting names of employees, they were getting all the status updates, they were getting all that information that was being utilized to make decisions, yet they weren't questioning it. In fact, they did even worse. When the employees were up in arms and they were fielding hundreds and hundreds of calls from members, normally what happens is they'll keep a log of those calls and or emails, and just so that when they're going into a discussion, they can say, well, this is what our membership feels. That list, that information was forwarded to the chief of police from the union with people's names on it.
Mm-hmm.
So,
Wow.
so they were then identifying to the chief of police.
These are the guilty ones. These are the guilty ones you got to take a second look at, type thing.
Yeah, because that then caused so much professional harm, personal harm, professional harm. It led to discipline of some employees, led to the loss of their jobs. I mean, not only did the union not back people by even allowing a grievance to go forward, they're not backing them now when they're asking for help. They're saying, look, we have injured workers, we have vaccine injured people. You guys have a file of statements from those workers, and we have some alleged deaths. What are you guys doing? You should be doing something about it. And they're not. It's a political decision.
Okay.
It's a political decision.
So it seems to me like we have a number of component parts here that are working together along the same with the same aim in mind, and that is obviously to get people to acquiesce to these mandates, these new demands, these loss of rights. So in my experience, when you see a couple of component parts working together in unison, that speaks to an organized and engineered effort that ultimately has to be controlled by a higher authority. I got a military background, so I know about higher authorities. But so in your research with your discovery process, did you find any evidence that led to a higher authority telling all these various disparate players to play a certain tune? Did you see anything?
Yeah, there's a lot of intergovernment communication. So they documented everything, which was quite nice for my side, because it's in meeting minutes, it's in it's in their pandemic committees, it's in email chains, you know, that they were getting pressure from the government representatives as well as municipal government representatives to make examples, to gain voluntary compliance. I mean, these are things that were written down in black and white here, is that, you know, we need to make some examples out of people. They knew that this was not enforceable, so they were trying to gain voluntary compliance through education. You know, there's a lot of that type of discussion going on in these in the notation, and it's actually quite concerning because, you know, our police are supposed to be independent. There's supposed to be oversight for our government. They're supposed to stand for the law and ensure that equal treatment under the law. And they're to uphold that law beyond politics. And if they're allowing government officials to come in and then being told to make examples, and they made examples of their force too by telling them this was compulsory, it was mandatory, are even talking about taking disciplinary action for somebody not wearing a mask properly. You know, what can we do to gain more compliance in our membership, knowing it wasn't enforceable legislation? So, you know, there's some significant breaches there, and open breaking of the law that's demonstrated in their own words. Like,
were you actually seeing the names of politicians pop up in these pieces of paper and correspondence? Yes.
And the chief medical officer of health was approaching the chief of police here to see how they could enforce public health orders. So there's clear documentation.
Were there any references going beyond the provincial level up to the federal level?
So they were constantly doing updates with the federal government. I'm not sure how those flowed out, but actually what we were seeing is that there were, because the chief of police in Edmonton sits on many associations for chiefs of police, you could see the flow of information through those organizations, and they're included in the disclosure documents from the International Association of Chiefs of Police, and there was direction coming down. And there was also the attendance in January of 2021, beginning of January, so the 6th, where Dr. Fauci, Anthony Fauci, did a webinar related to the vaccine for law enforcement. And our law enforcement here joined in on that meeting and then took advisement directly from Dr. Fauci.
Oh. Well, this is I wasn't even thinking of going beyond the provincial and federal level to the international, but you've brought that in quite nicely, Natasha. That is absolutely incredible. And so on the police side, we actually we have a trail that goes all the way up to the international level. On the public health side, I would suspect we have the same thing going from the province to the federal level to the international level, probably at the World Health Organization level. And we saw in spades how the WHO was very active in promoting vaccines around the world. As a matter of fact, they were lambasting Canada because we were hoarding too much vaccine, and it wasn't being allowed to go to the Congo or go to Botswana or go here or go there in Africa. I recall that very well. So, you know, you just got to stop and think about this for a while, because this really speaks to kind of a coordinated effort at the highest level, and it's not a nice. Like, I guess it started out as a nudge type thing where, you know, doctors were given $25 for a cold call to a patient who had the temerity not to get vaccinated. But it seems like it's gone well beyond the nudge phase into the active coercion phase, where, as you say, people lost jobs, lost their careers, lost probably marriages, and in many cases their health as well. So where are you going to take this next? I mean, this is just endless. I mean, you could go. It looks like it's pretty comprehensive what you've tapped into here. Where are you going to go?
Well, that's some of the challenges. So this, not only did I take it to provincial level government with my recommendations, but it's also now in the hands of federal government officials to be able to then, right now they're dissecting the report to see and the evidence in the large report to see what actions, and I imagine there will be some committees and stuff that start up in order to obtain some of the additional documents out of this, because that's just it. My report's just a starting place, and
Yes.
there's so many areas to go into where there was failure or influence. There's absolutely zero reason that somebody from Alberta Health Services should be making demands of our police force. That's not their role. And that happened at any other time for something, you probably get a good go deal with the minister first and come back and talk with us kind of statement. But there's so much that's inappropriate, and for me, I'm just trying to at this point be a voice for those police officers, because they still can't speak, they're still muzzled, they're still shackled, not being able to do investigations. If they spoke out as an active duty member, whether they're RCMP or City Police Services, they will be disciplined harshly by their employer. And so right now I'm trying to get the information that's in this report out to as many people so they can see what's been done and encourage people to then go and get additional information requests. It might take time. I've been encouraging employer or the business owners who were the influence that was put on them from the fact that they felt law enforcement was going to come into their business and shut them down. Governments utilize that fear when the information is showing that they were actually having discussions that things weren't enforceable.
Yeah.
And
They
so
had no
that,
grounds. They had no reasonable grounds to even do that. But it
yeah.
seems, Natasha, like the police have been captured by political aims. And when we're talking about how high up the chain this capture goes, it looks like it goes all the way up to the international level at the highest levels of our our globalist agencies and institutions. So, but the mind boggles. I mean, this talk about conspiracy theories. This is one that is just you know for the ages. I mean, this is incredible.
Yeah, it's not
But
a theory. It's not
don't
a
you worry?
theory. The documents exist,
Boy,
right?
you've kicked over a hornet's nest here. Now,
Yeah.
don't you worry that as you take this up the chain, you go to the provincial authorities, the federal authorities. You got to take a look at this. Look at what I found. Look at these disclosure documents. That they're just going to shut you down there because they're part of this cabal. It looks the evidence is there that they are part of this whole coordinated effort, this whole psychological operation to instill fear and make people do certain things. Aren't you afraid that they're just going to turn you down?
Well, that's a possibility. I told them though, in the meetings that I've had, that I'm giving them an opportunity to pivot and do the right thing.
Wow.
And they will get one opportunity to do that. And then reality is, if they choose not to do anything, it's because, number one, many times they wouldn't be able to because they are criminally complicit in what's happened. So,
Wow.
I just make a note of who I've talked to, who I've given the document to, and they're all made aware that accountability does come at some point in time, and that now they have this information in hand. They
Yeah.
have an opportunity to then say, I'm now going to choose to do the right thing, do the right path, and support further investigation on this document, even if that risks me personally. So they're all scared about saving their own butts. But I'm like, you're not going to save your own butt in this. Like you're just not. Eventually,
No.
Eventually you will be investigated as well, but you have an opportunity here to say, I didn't do the right thing there, or you don't even have to acknowledge it. Just pivot on your stance and use this as your ability to change that discussion within your groups. And yeah, they might
Mm.
try to address it with me, but I've developed a document that is just pointing out their own words. So,
Yeah.
people can take my recommendations or not and toss them out the window. That's their own personal choice, and that I'm okay with that. They don't agree with something I've put in there as a recommendation, but they can't argue the black and white facts that I've extracted directly out of the document, which is why I did it that way.
Yeah, and I think the other thing that you can do, and you're obviously doing, is to get this information out to folks like me in the trenches who can talk to maybe 10, 10, 20, 30,000 people about this and get that word out that way to maybe put a little fire under everybody's butt there. But I got in closing, I guess I'm left with I'm in awe. You're a very brave lady, and I've got to ask, where's this come from? Why would you do this when so many others would just let it slide and not be bothered? What's in your background? What's in your makeup that propelled you forward? You're obviously compelled.
You know what? I've always been on the side of advocating for people who don't have a voice. And I've done that forever. I've worked on dead people long enough that we all come in and out the same way. It's just how we treat each other. And when I see mistreatment, I mean, our seniors are still being locked down here in Alberta in the care centers, and that's abuse. And
Yeah.
they don't have a voice, and our kids don't have a voice. And what drives it for me, I mean, I have young adults as children and they're friends, and they're just broken. They've been broken by the past few years. They don't see hope there. My kids are a little bit different, only because, they've got me supporting them, but it's, I looked at it and went, I have a skill set. I have an ability to do this, and lots of people don't. And I know a lot of people aren't necessarily or wouldn't. I've had people approach me. I would never put my name on that report. And I'm like, well, but that's the difference, is that I would, because I know what I've put in there is factual and truthful and needs to be told, and I'm not worried about it being a firm killer, right? That the hand that feeds me isn't going to cut off the money supply because all of a sudden I did a report that wasn't favorable. Yep. Yeah. And so I'm kind of, I think I'm rogue for these guys, and that's probably a good thing, because I sit back and go, my world, my professional world changed, and that's okay. I'm okay with that. I've changed my career a few times, and I never had that fear of changing my career for the right reason, right? And so,
Well, I think
I love it.
as I say, I'm in awe. You're a brave lady, and I think Canada is very lucky to have you, because I got a feeling this is it's going to be pretty hard to ignore, especially by rank and file Canadians who are looking around at the landscape here and deciding that things are not right in the state of Denmark here, or in the state of Canada. So with that, is there anything that our C3RF or Veterans for Freedom folks can do to help or support, or what would you like them to do?
Get the information out. I mean, right now our law enforcement and our military are painted with such a horrendous brush in the media. And when these guys came to me and asked for my help, I was humbled by the fact that they approached me. And if I'm able to support them and give them support out and get people to turn and say, yeah, no, we don't have just a bunch of thugs in our policing. And because that's really important. And I know our veterans are feeling the same way, is that everything out there is to make people not support these guys, and they deserve our support. They're battling inside, and the only reason they're not leaving those abusive workplaces is because they worry about who would step in their place. And these are the most courageous people going in and getting the still getting harassed and abused and intimidated to today, just to make sure that it's not a person there who would violate their ethics and their morals just to follow an order. And what your guys' group can really do is just make sure that the message gets out that, hey, we got good guys inside fighting really, really hard, and we need to support them.
Okay, I think I can accommodate that request, and I'd request that everybody who listens to this interview do the same thing, and let's put our shoulders behind the wheel here. Well, thanks for that very much, Natasha. It's been wonderful having a chat with you, and all the best in your future endeavors.
Yeah, thank you very much for having me on, Russ. Have a good day.
Okay, bye-bye.